Thank you, Chairman. Thank you, Madam Secretary. A couple of things that we totally agree on is that cost was the biggest issue, I think, in healthcare. If we could lower the cost, more people would have access. I think there's no question about that. And that's been a concern of mine through my career as a physician, one of the reasons I ran for Congress. I chaired the subcommittee on health, employment, labor, and pensions. So we look at individual markets and small group markets. And our state insurance commissioner in Tennessee, I spoke with her 2 weeks ago and then reconfirmed these numbers. The small group market in Tennessee will see an average increase of 50 to 55%. And the individual market, depending on your age and gender, it will be 45 to 70% increase. And I asked how many plans we had from mountains to Memphis now in our state. And we have about 8 plans that individuals and small groups can go to. And we'll have, after the first of the year, 2 and maybe 1 plan. So that didn't expand the number of options. And one of the reasons our Governor Haslam in Tennessee didn't expand Medicaid in the state and chose not to expand the exchange was because he couldn't get answers from HHS so that he felt comfortable in doing this, because we have had a 20-year history of health care reform called TennCare in our state. Hasn't worked out all that well. So when we held this subcommittee hearing a month or so ago, I'm going to submit some questions that I got there from the businesses, if you don't mind, so we won't take the time. But one of them was Mr. Silver, who said, "I'd like to challenge the Secretary to make a good program to implement changes that would not have a negative impact they have now. It is beyond belief how complex, needlessly, and how complex this program has become," and that is my question. I think what he's saying as a businessman, and I'll give you another example. Mr. Horn has a business over there, 350 employees. He's self-insured. He provides total preventative services. If you need a mammogram, whatever, he pays for it all. Guess what he gets for this? He gets a $63 per person fee that's charged to him, plus an increase in his taxes. He did everything right in his business, in the textile business, which is a tough business. So how do you answer his question? What do you say to Mr. Horn?
And his question is, why do I pay this?
Why does he's paying for everything. Preventive, he's got the gold plan, and yet what he gets are increased taxes and increased cost to his business.
Well, I think that the way that the law is put together, there are fees and taxes that pay for the program to move ahead. I think in the long run,
he's a guy doing everything right.
If everyone, he also is paying a hidden tax, I would say at this point, because his hospital rates are higher.
It isn't hidden, I can tell you that. It's out there for him. He's got to write a check for it.
I understand.
One other question I've got
here. The gentleman's time has expired.